Anxiety. In panic disorder, you have regular panic attacks. Panic attacks can be alarming. Sudden bursts of fear, perhaps accompanied by apprehension or a sense of. You may have physical symptoms, such as sweating, dizziness, a rapid heart rate, difficult breathing, a choking feeling, or the inability to shake or tremble, instability, an illusion of dying or going crazy, and panic disorder may. Agoraphobia is the subordination of the fear of any place for which escape would be problematic. For example, the inability to come out of the theater or shopping mall. The scientific treatment eliminates the symptoms associated with agoraphobic resulting from panic. Treatment of the disorder often faces removal through psychotherapy and drug therapy. Sore throats are common and usually can be resolved without specific. Viral infections are the most frequent of the infections that lead people to sore throats. Less often, you may have a bacterial infection known as strep throat. Infections are certainly not the only cause. Allergies might cause chronic acid reflux and respiratory mucosal congestion. Throat could be a symptom of a severe medical problem, so it needs to be taken seriously. Specific causes of a sore throat could prevent your airways and remove your oxygen if not attended to immediately. One or more of the symptoms listed below can cause blood-tinged severe tonsillitis, inflammation of the tonsils, a peritonsillar abscess, infection around the tonsils, or epiglottitis. Take your time with your doctor, or seek urgent care in a medical emergency. If you cannot breathe, or if you face severe throat pain, see your doctor the same day. The doctors may diagnose strep throat, or go immediately to what is usually required treatment with an anti-infective. If you have infectious mononucleosis, you'll most likely recover slower. It may take several days. Return to work or school. If you suspect mononucleosis, your medical professional will inspect your spleen. A dangerous consequence of mono. If it enlarges, you will need to restrict your participation in contact sports for the next few weeks. Inflammation of the pancreas. Individuals suffering from various varieties of chronic pancreatic inflammation suffer from pancreatitis that can permanently damage. The primary function of the pancreas is to produce digestive enzymes and hormones, such as insulin. If the pancreas suffers from damage, it can affect the digestion of food, the absorption of nutrients, and hormone production, which can increase the likelihood of anorexia, diarrhea, weight loss from malnutrition, vitamin deficiency. Chronic pancreatitis can take years to develop and can be caused by excessive alcohol consumption over several years. In only about 5 to 10% of alcoholics, the likelihood of development will go into remission upon ceasing alcohol use. It is thought that those who continue to drink after 1 or 2 bouts of alcohol-related acute pancreatitis are more. In rare cases, a single acute episode of acute pancreatitis can result in chronic pancreatitis. Addition to abuse of alcoholic beverages, the causes of chronic hereditary chronic pancreatitis is a rare genetic disorder that is thought to increase the probability of an individual's developing the disease, typically before the age of 20. Mutations of the cystic fibrosis gene are the most commonly recognized genetic cause. If the enzymes in the pancreas don't drain, they can back up and cause harm to the pancreas. If the blockage is detected in time, it can be treated with surgery. Endoscopic retrograde cholangiopancreatography, ERCP, is a surgical procedure. The Crohn's disease or chronic autoimmune pancreatitis. Many people develop antibodies that attack their pancreas for unknown. Sometimes, the pancreatitis cause cannot be identified due to the extremely high TRIG levels. The most common symptoms are abdominal pain as well as vomiting, nausea, and the pain can occur on any device or at any time and can be mild or intense, as it can worsen over time and more of the pancreas is eliminated, the pain can become less severe. During a flare-up, the pain can be exacerbated by drinking alcohol or overeating some food. Because a damaged pancreas can't create the necessary chronic pancreatitis can cause difficulties digesting food and absorbing nutrients. This may lead to weight loss, vitamin deficiency, and greasy, foul-smelling stools. The pancreas may also slowly insulin, which can cause type 2 diabetes. Matthew, the video creator, is 83-year-old cancer/stroke survivor who would like you to know his passion for helping others by spreading good health information. Please help by taking a moment to subscribe and like this video.